Very good welcome to this session. My name is Amita Prudence, Bachelor of Science in Midwifery. We shall be looking at Introduction to Fundamentals of Midwifery. As we all know, midwifery has become one of the basics in the community. And when we talk about fundamentals or foundations, we are looking at the basics and something you cannot skip before you know more about midwifery. So generally, it's like a foundation or something that you lay before you move to the next details of midwifery. So as for today, we are going to have objectives that we shall look at. One, definition. We have history of midwifery, principles of midwifery, characteristics and scopes. So as we are going to follow the objectives, we shall be having some other headlines which are not mentioned in the objectives. So now, we need to know the definition of a midwife and midwifery. So a midwife is a person who, having been readily admitted in midwifery education program duly recognized in the country, has successfully completed the course of study in midwifery and acquired the requested qualification to be registered and legally licensed to practice midwifery. So as you are seeing, we have highlighted points, and those are the major points that you focus on when you're defining who a midwife is. So a midwife is a person. It does not mean, most times people confuse this. When we say who is a midwife, they think a midwife is supposed to be a woman. That's why I want you to take it like a midwife is any person who is already admitted to do midwifery education program, just like you. So, having been qualified to enter the midwifery program, you must successfully complete the course. That means if at one point you are going to stop on the way, you might not be qualified to be called a midwife. Then you should also acquire the requested qualification to register. That means there are cut-off points that will not make you to be called a midwife. And then you are supposed to be legally licensed to practice. So at the end of it all, when you finished your midwifery program, you are supposed to get license that will allow you to practice. So a midwife is basically a person. Then we move to midwifery. Simply, just like nursing and any other profession, midwifery itself is a profession of providing assistance and medical care for women and girls undergoing pregnancy, labor, delivery, and postpartum. So let's go to the global history and trends of midwifery. Midwifery has been there since even before it was documented, because we saw how people used to multiply those days, even in the Bible. But it means there were some people who were assisting others to deliver. So midwifery has a long and diverse history across cultures worldwide. In the recent years, there has been a resurgence of interest in midwifery due to its positive outcome and women-centered. So you find that midwifery is all about care for women. When we talk about women, we mean women, all, either girls or ladies, so long as the person is a woman. Many countries recognize midwifery importance and invest in its development. Just like the theme for last year's ICM, it stated that midwifery, a vital climate solution. So without midwifery, you find that the country, there would be some kind of difficulties in development, because midwifery assists in helping women to increase the number of population. And if we do that without putting them at risk, both the mothers, we find that we are really helping to invest in development of the country. Midwifery history in South Sudan. South Sudan has a rich tradition of midwifery care provided by skilled birth attendants within the local communities. I believe that's why most of our people in the community, they really prefer to be attended by the local people. That's because they have been there before the real midwifery science has been introduced. So, despite the country's challenges, efforts are underway to improve maternal and newborn health by developing midwifery services. So you find that in this country, there are a lot of health institutes which has been introduced with the aim of fighting maternal and mortality death rates. So the country is really doing so much to make sure that the history of midwifery is improved. Training programs and initiatives have been implemented to enhance skills and capacities in South Sudan. Even the people who we say they are the traditional birth attendants, they are undergoing trainings right now or to make sure they improve on their skills such that they're able to help in the community there where the health services cannot be reached. So let's look at the characteristics of midwifery as a profession. So one of the characteristics of midwifery is expertise in normal pregnancy and childbirth. So as a midwife that you are, you should know that it is a very specialized profession. That means whatever you do, you should know that you're a specialist in it, especially in normal pregnancy and childbirth. So midwives possesses specialized knowledge and skills to care for women with uncomplicated pregnancies and birth. So anything which has to do with normal pregnancy and childbirth, it is the midwives who handle. Then continuity of care. Midwives establish trusting relationship with women and provide personalized care throughout the reproductive cycle. So you find that the people that women really trust with whatever secret they have in line with the reproduction is midwives. So one of the characteristics of midwifery is it really enhances continuity of care to all women. So it helps them to entrust themselves, their secret and whatever they have in line with reproduction with the midwives, and hence it helps the midwives to provide the care that they need. Advocacy and empowerment. Midwives support women in making informed decisions, advocating for their rights, and promoting their well-being. So all what midwives do is to make sure that women and girls get or attain their full rights when it comes to sexual and reproductive health, and also promoting their well-being. So next is the midwifery model of care. So midwifery model of care is that unique, nurturing, hands-on care given to women before, during, and after childbirth. So as a midwife, you should have this. When we talk of unique, nurturing, hands-on care, it means as a midwife, you cannot say you're a midwife when you don't practice. There's nothing like theoretical. Yes, you have the theory, but you should make sure that you touch something. That's what we mean by hands-on care. So a women-centered approach that emphasizes the mother and the baby's physical, emotional, and social well-being. So let's look at the principles of midwifery. So the first principle of midwifery is promoting natural childbirth. As we all know from the previous presentation, we said one of the characteristics of a midwife is their expertise in conducting normal pregnancy and childbirth. So now we are promoting natural childbirth. So under this first principle, promoting natural childbirth, we see that midwife prioritize the promotion of natural childbirth, supporting women in experiencing birth as a normal physiological process. So in most cases, we want to support women to experience the normal physiological process of childbirth. Much as we see that these days people have elective cesarean section, but what is best is for us to make sure we provide the mothers with the information so that they know that experiencing the normal physiology of childbirth is very helpful as a mother. They also minimize unnecessary medical interventions and interventions that may disrupt the natural process of labor and birth. So as a midwife, one of the ways you promote natural childbirth is by making sure that some medical interventions which are not necessary at a point in time is not provided to a mother. Let's say a mother will come with a big baby, but you find that the baby is not that big. Actually, that person can deliver vaginally. So what do you do as a midwife? You assess if the cervix is adequate enough and the pelvis is adequate enough, and then you prevent unnecessary medical interventions like operations, others like episiotomy, forceps, if you know the person can go through with the process of natural childbirth. So we encourage that midwives should know when medical intervention should be done. Midwives employ evidence-based practice that ensure the safety of both the mother and the baby while honoring woman's autonomy. So the midwives employ evidence-based practice in most cases because we want to make sure that both the mother and the baby, they are in safe hands and they are safe whatever interventions that you are going to bring through. So the principle number 2 tells us about respecting women's choice. Midwives respect women's rights to make informed reproductive health and care decisions. So we are not going to decide for these women. The only thing we shall do is to make sure we give them the necessary information and allow them to make their own choices. So that is what we call informed reproductive health and care decision. They provide comprehensive and unbiased information to empower women to make choices that aligns with their values and preferences. So whatever intervention you intend to give the mothers, it should be what they value and what they prefer, but not what you prefer. So that is how you are respecting the woman's choice. Midwives ensure that women are active participants in their care and have autonomy to make decisions throughout the reproductive journey. For example, let's talk about family planning. When it comes to family planning, most times we have seen that women actually come when they already have in mind a type of family planning method they want to use. So what we do, we give them even education on other types of family planning, but still allow them to participate actively in making decisions on which type of family planning they think can help them. So by that, you will be respecting their choices. 3, Principle number 3, providing individualized support. So midwives recognize that each woman has unique needs and experiences. So not all childbirth is the same for all women. So you should be able to recognize each and every woman with their unique needs and experience. Then you go by that. They need personalized care that consider the physical, emotional, and social aspects of women's well-being. So as a midwife, you should know how to personalize some care that will consider the physical. That means you need to look at somebody physically, emotionally, and their social aspect. So it means you should not be judgmental as a midwife, because you cannot look at a woman and start judging them. You cannot look at a woman and start thinking of what type of social aspect they undergo. But you can also still look at them, and it helps you to make some interventions, maybe in form of advice, but not to insult them. Midwives establish trusting relationship and create a supportive environment to address specific needs of each woman they care for. So you find that as a midwife, you need to make sure that the women you are handling have trusted you, or they can trust you. Without their trust for you, you find that it will be difficult for them to cooperate with you in most cases. So those were the principles of midwifery that a midwife has to know. Then the roles of a midwife. So one of the roles of a midwife is that they monitor the health of the mother and the baby, provide prenatal education and support, and offer guidance on healthy lifestyles and choice. That is straightforward. Midwives also identify and manage any complication that arise, collaborating with other healthcare providers when necessary. So that means you're not going to be working as a single person, but you need to collaborate with others if there is need for you to cooperate with them. So other roles, midwives are skilled in facilitating normal childbirth and providing continuous support to women in labor. So as a midwife, you should be skilled enough to perform your duties to ensure that the mother has a normal childbirth. You are also supposed to monitor the progress of labor, providing pain relief options, and offer emotional and physical support throughout the birthing process. So we are really known for slapping, beating women when they're in labor. But we should also consider emotions and physical support when a woman is already in labor or in the birthing process. Midwives are trained to recognize and manage any deviation from the normal course of labor, ensuring safety of the mother and the baby. So as a midwife, you are supposed to be able to recognize if whatever the woman is undergoing is going off. That means you should know the normal part of handling or normal part of midwifery more than anything. That helps you to detect if there's something going wrong. Midwives also offer support in breastfeeding, newborn care, and maternal recovery. Somebody will ask me that. How do they offer support in breastfeeding? Yes, we offer support in breastfeeding by making sure that we teach the women on how they can handle their babies during breastfeeding, how best can they breastfeed, how best can they take care of their newborns, and we also educate them in a better way for recovery. So that is your role. Midwives also assess and address any physical or emotional challenges that may arise during postpartum, promoting the well-being of both the mother and the baby. Though this is not always practiced by qualified midwives, but it is our role and duty to make sure that even after delivery, we still follow up the women to make sure that both the mother and the baby, they are safe emotionally, even physically. So you can, if you are in a busy setting, you can make sure that you get their contacts and then you follow up on phone to find out how both the mother and the baby is doing after they have been discharged home. So our next is midwifery and continuum of care. So midwives provide care throughout the reproductive cycle from preconception to postpartum. So as a midwife, our basic role is to make sure we continue to care for the mother and the baby until when they are okay and we know that they're safe. So we provide care throughout, right from reproductive side, from the time they want to conceive and even after delivery. They contribute to family planning, preconception counseling, and antenatal care, ensuring comprehensive support for women and their partners. That's why we are really trying hard to make sure that there is male involvement in attending antenatal, even childbirth. So this helps us to educate the men also and to know that they have to be as one to make sure that the woman and the mother and the baby, they're in safe hands. So the mother and the baby, they're both healthy. Midwives promote a seamless continuum of care that addresses women's diverse needs and promote optimal health outcome. So we go to midwifery and advocacy. I believe we all know what advocacy is. Midwives have advocated for women's rights and improved maternal health care. So it is us, the midwives, who are supposed to advocate for women's rights and also improvement in the maternal health care. That means whatever we see that is being diverted and putting women and girls at risk, we should advocate for it. So they should also work to ensure equitable access to quality care, access and systematic barriers, and promote policies changes prioritizing health. So as a midwife, one of the ways to advocate is to make sure that there is equitable access to quality care for women, addressing systemic barriers and promoting policy changes. So there are some policies that might not be favorable for women, and yet we find that it's unhealthy. So as a midwife, that is how you advocate, make sure there is equality in quality of care. Midwives actively participate in professional organization, community initiatives, and policy development to advance the field of midwifery. So the field of midwifery has been there as combined with nursing. So now we actively advocate in professional organizations. So there are some organizations which would want to support midwifery field. So it is the midwives who are supposed to advocate for such. Then through advocacy, midwives strive to improve maternity care outcomes, reduce maternal and neonatal rates, and enhance women's overall well-being. So that is how we do advocacy. The advocacy will help us to make sure that there is that equal chances for both women and men. Midwifery in unserved community. So midwives play a crucial role in providing care to unserved communities where access to health care might be limited. For example, we can look at some communities where there is environmental disasters, or maybe there is an accessibility or infrastructures have not been put in place, and yet we know in a community we have women who are getting pregnant, they need to deliver, and they need to be taken care of after. So in such setting, we have midwives like you who are supposed to follow up these people, even in those unserved communities. So if you identify a community where services are not given to women, you can still advocate for services to be delivered to that community. Then they reduce health disparities by offering cultural sensitive care and promoting community-based intervention. I think this is practiced even in your later years. You'll be able to see that you should go for community-based interventions, especially after deliveries or even before the women conceive. So this helps to offer cultural sensitivity, such that some cultures or some traditional practices that might put women's health at risk should be prevented. Midwives in this setting often work closely with community leaders and organizations to improve maternal and newborn health outcomes. So as you plan to reach out to the unserved communities, you don't do it on your own. There is need for you to communicate with the community leaders and other organizations to support your advocacy. Midwives research and evidence-based practice, midwifery. Midwifery practice is informed by research and evidence-based based on guidelines. So you find that each and every time there is going to be research which is done according to how best women and girls should be assisted. So all these research which are done, they're evidence-based and they are guidelines which are supposed to be followed. Midwives actively contribute to research, conducting studies to improve maternal and newborn outcome. Evidence-based practice ensures that midwives provide care based on best available evidence, promoting optimal health and well-being of women and their families. Midwifery and collaborative care. So midwives collaborate with other healthcare professionals to provide comprehensive care for women. As a midwife, you're a specialist, right? But you need to collaborate with other healthcare professionals, especially when you identify deviation from the normal delivery, pregnancy, or even after childbirth. You need to involve other healthcare providers. Then you should work as multidisciplinary team, consulting and referring to obstetricians, pediatricians, and other specialists that are needed. So it means that you work as a team, multidisciplinary team. If you need obstetrician or need a pediatrician, you make sure you inform them based on what you have on ground. Then we have collaborative care to ensure women receive holistic and integrated health care services throughout their reproductive journey. So the collaborative care is not among the team of health workers only, but also with the team of women that need to receive holistic care. Midwifery education and training. So as you see, midwifery education encompasses a combination of theoretical knowledge and practical skills. So the theoretical knowledge is what we are receiving right now, and the practical skills, we can either get it through OSPE or even on hands-on in the hospital. So that is the practical skills. Training programs vary across country, but generally includes coursework, clinical rotations, and supervised practice. So as you join this midwifery program, you should know that throughout the training program, there is going to be coursework, clinical rotations, and other supervised practice until when you qualify to practice on your own. Midwives undergoes rigorous training to develop competence in antenatal care, labor and birth, postpartum, and newborn care. So that's where we shall stop.